Hello, everyone. This is Jason Berry with the Digital Health Wire Show, and I'm excited to be joined by Velamoor, the President and COO of NextGen Healthcare. Shri, good to see you.
Great to see you, Jason.
So for anyone who might be unfamiliar, can you give us a lay of the land of the work that you're doing at NextGen and just your overall reach?
Yeah, NextGen Healthcare, for folks who don't know, we are a leading provider of ambulatory cloud-based solutions, primarily focused on supporting ambulatory practices. We have over 10,000 medical groups that we support today across 40 different clinical specialties, everything from clinical workflow solutions to financial solutions to consumer solutions. And we're excited to be leading from the front on disrupting provider and patient experience.
Fantastic. And when you look out at the trade show floor and all these companies that are here and the work that you're doing, what are some of the technologies that you think are poised to be the most impactful in the near term?
Probably the biggest, there are three areas of interest, I think, just given the nature of the environment right now. Solutions that are essentially addressing the efficiency of medical groups and practices, allowing them to do more with less in a resource-constrained environment. Mm-hmm. So there's a whole bunch of solutions out here that are taking administrative tasks and automating them or using AI to essentially simplify the number of folks that the practices need, particularly when they're dealing with clinician and administrative staff shortages. Mm-hmm. So that's area one. Number two is things that are really improving the patient experience. So as consumerism becomes more and more important in healthcare, we're seeing that patients want to do more. They want to do their own research. They want to search. They want guidance and clinical decision support. And there are solutions that are helping connect the different parts of the journey for them that are very interesting. And then, of course, every solution out here is AI enabled. And I think there are a bunch of solutions out there that are impacting the provider experience positively, everything from scribing to clinical documentation to other things. So those three, I think, are all incredibly interesting.
It's a great trinity, and yes, all of those have a lot of momentum out on the show floor. Yeah. What do you think is standing in the way of realizing the potential of each of those areas and where we're at right now?
Yeah, and we were just talking about this earlier. I think for us, it's really important to remember not to forget the care part of healthcare, continuing to keep humans in the loop and the empathetic touch that patients, providers, everybody want at the end of the day as they're adopting these solutions is critically important. A paradigm that we find very interesting to think about is AI is not just artificial intelligence, it should be augmented intelligence, where these become co-pilots or support for providers and patients to do what they do versus a replacement. And I think that continues to keep that human touch in healthcare in all the venues that matter. The second area that I think we need to pay attention to is there's a bunch of uncertainty right now in funding environments, policy, regulatory actions, and what might happen with the administration. So yes, there are fantastic technology tools, but can we actually afford them and have the ability to deploy them in all the environments that we want to? So we have to pay attention to that.
Yep. And what can both physicians and providers look forward to as far as if we excel in all of these areas and we can really create this futuristic type of care delivery experience? What might that look like, and what are some of the things that we'll see as a part of that?
Yeah, in one phrase, we like to call it the new UI is no UI. So that I think encompasses what we should expect holistically, and this is something that NextGen's excited about as well. We're looking to change the physician and the patient encounter, the entire paradigm from what it is today, which is a high-touch, high-friction experience, to something that is voice-enabled, that's supported with intelligence, that minimizes the number of clicks and friction and transitions that happen across different systems. So it's going to feel a lot more natural for all the parties involved.
Nice. Natural experience, better care delivery. Looking forward to it, and glad you're driving the ship.
Thank you so much, Jason. Great to meet you.
Thanks, everyone. That's been the Digital Health Wire Show. We'll catch you next time.